Welcome to the Nursing Career Transformation Roundtable. My name is Kate Loving-Shank of katelovingshank.com and author of the Prayer Prescription series and creator of Kate Loving's podcast, Prayer Prescriptions that Rewire Assumptions About Your Everyday Reality. I'm really excited today to bring on as our guest Jill O'Hara, who is a holistic health practitioner. And also over the last several weeks, we've been talking about entrepreneurial opportunities for nurses, as well as all of the different things that are available to us as nurses that really don't have to incorporate going to a hospital every day to, get a paycheck. So I'm very excited to introduce Jill O'Hara at this moment. Welcome, Jill.
Well, thank you, Kate, for having me. I am really excited to be here and be able to share in this opportunity to, interact with some beautiful people and be able to, share what I have, and hopefully someone will be able to pick up a little nugget or two from it.
And I just before we went on the air, Jill was telling me that she lives in Buffalo. I'm not laughing at anything. I just know that the weather out there is frightful. So congratulations on being able to tolerate that kind of amazing, ability to thrive and survive. So that's great.
It's quite the experience, and I suppose having lived here the vast majority of my life, you do get used to it. Believe it or not, it really isn't anything out of the ordinary. It becomes, perfectly acceptable to have 7 feet of snow pile up at your back door. So you just, keep on going.
Plow through, right?
Yes, right.
So, Jill, what originally drew you to the nursing profession to begin with? How old were you? What was it that you envisioned for yourself as a nurse?
Wow. Actually, my first recollection of wanting to be a nurse, I was 5 years old. I went to my kindergarten Halloween party dressed as a nurse. And I played nursing and doctors as I was growing up and took care of every animal that fell out of a tree or got bumped or banged. And eventually, when I was 13, I became a candy striper, which I don't even know if they have candy stripers anymore. And eventually, just move forward. I did go to school to become an RN because it was just something that really was just inside of me. It was something I knew that I had to do. I believe that I've always felt that I was just a healer. My grandmother was a nurse, and I think she was, definitely a role model for me. And I did work in traditional nursing for 20 plus years. I worked oncology, I worked ER, ICU, and management were the main areas of focus, and I certainly got tons of experience, in that respect. It was awesome.
And how did you then decide? What was it that made you decide to get into holistic nursing medicine? Is this something that you actually incorporated in your practice in the Western medical tradition, or did you suddenly start? Was it that you were drawn to holistic nursing through some study, or has that always been your interest?
You know what? At some point, probably in my high school days, I was introduced to very small components of holistic practice. But once I left traditional nursing, I left there and I opened my own business as a healthcare consultant. And I began working with child care centers, school-age programs, and then eventually in the community. But what really, really drew me to holistic care was about 13 years ago, I was diagnosed with pancreatitis, and oh my God, nobody ever wants to get that. It's horribly, horribly painful, and you're sick for weeks on end. Only mine turned into a chronic case of acute episodes. So about every 3 months, I would have an acute attack of pancreatitis. And I'm sure as a nurse, you know that there isn't much you can do. You give IV support, you give medication, for pain, which barely manages it. And after about 2 years, the GI doctor I was seeing said to me, Jill, I don't know what to tell you. I'm concerned, you're going to end up with pancreatic cancer, and I don't know what else to do for you. And they had run every test that they could and, looked into every angle. Why was I getting this? Was it the gallbladder? Was it the wheat allergies? Whatever. And finally that day came and he said, just threw up his hands and says, I don't even know what to tell you. I'm worried. And I just looked at him. I said, you know what? I don't like your diagnosis. I don't like your prognosis, and I will find a way. So I left his office determined that I am going to find a cure for my pancreatitis. And at the time, I actually sat on a board of directors with a physician who was a naturopath and just an amazing woman. She taught me much over the previous years. And I saw her for acupuncture, which was very helpful. Mm-hmm. And as we were talking, she said, I think maybe you should meet my friend, who works in the office. She does energy work. So I went to her and I had my first meeting in my first session of Reiki, which is energy medicine, using the energy from the universe to help the body and the mind to heal. And I walked out of there like, oh my God, what was it? That was amazing. I have never experienced anything like that. The state of relaxation was so complete and just so comforting and wonderful. So naturally, I scheduled another appointment and booked my first level 1 training session so I could become certified on how to do this amazing technique. My second session, I went and had my Reiki experience again, which was awesome. But at that time, I had an emotional revelation and healing and realized that my pancreatitis wasn't physical, it was emotional. I had an emotional attachment to someone who I really cared deeply for, who had died very young at about age 35 of pancreatitis, pancreatic cancer. Mm-hmm. And I had somehow carried a feeling of guilt and frustration and anger with me for many years over that. And once I was able to make that connection, if you will, the spiritual connection with this man and say, geez, I'm sorry, I love you, I wish you were here still, the whole 9 yards, after that, my pancreatitis went and has never returned, ever. I did nothing else. Medicine didn't do anything, but using the healing energy that we all have available to us was enough to cure me. So that was really my road to getting into holistic care.
That is such a powerful story, and I really appreciate your sharing it. It's just, it really represents the potential that we all have, and maybe we have to find the avenues for ourselves, and certainly Reiki may not do it for somebody, but the emotional healing component is fascinating to me. And so when you became a Reiki practitioner, did you that were able to not just help others heal, but were you able to continue helping to heal yourself with the techniques that you know from Reiki?
Right. Well, with Reiki, the wonderful thing about that is the practitioners can use that to heal themselves as well. As we're administering Reiki to others, we are actually benefiting from that energy flowing through us, because that universal energy, and think about this, and as people, we have to understand we are energy. Okay, yes. Our body is nothing but energy. So when you've got that thought and that intention, you're bringing that wonderful energy through your hands and you're laying them on your patients, that same energy is working to heal you. So yes, my clients benefit from it. I benefit from it. I would love, and I'm getting closer to being able to get some more nurses on board and trained in Reiki, and so they can start touching more lives in a loving, healing way. It does heal physically, mentally, emotionally, spiritually. And this is the important thing about holistic care. You have to incorporate all of those things in order to really create a sense of well-being. When I look at allopathic medicine, we kind of look to, one way or another, alleviate the symptom. Okay? And that may be through medication, it may be through a procedure, it may be through surgery. What holistic care does is it goes beyond that. We go and we look for the root cause to get to that root cause. We look at lifestyles. We look at your nutrition. Are you getting enough supplements? Are you getting enough vitamins and minerals? And what kind of foods are you ingesting? What are your relationships like? Are they healthy or are they toxic? Yeah. How about your environment? Okay, so these are the differences between, healing traditionally and healing with holistic care. There's so many different avenues. Reiki is only one of them. I work side by side with Reiki and chakra balancing, okay, which is intuitively looking at the energy centers in the body. We have essentially 7 main energy centers, and they can get real clogged up, okay? And if those energy centers are not functioning properly, you end up with sickness. If you've got toxins in your environment, your relationships, and your foods, if you're putting yucky stuff into your body, if you're having difficult time with emotions or not able to de-stress, those things all build up in our energy centers. So basically what I can do is read those energy patterns and then work with the client to release them through, again, an energetic process where, you actually kind of just clean them out and get them re-spinning again. But the neat thing is you can take that beyond that. And I like to use color therapy because each of the centers respond to color. I use a lot of essential oils, which I call nature's medicine. They're wonderful. Or herbs. And sometimes it's just a matter of, people knowing that they have somebody they can go to, someone they can trust, that they can open up to, and, be willing to take a deep look inside at what's going on. So, yeah, it's enriched my life. And I just keep trying to pass it along to people. It's, just an exciting thing.
Yes, the whole idea of a deep look inside, and that requires a slowing down and an ability to take time to, to really be in the present moment, which I think our society has, a lot of people have lost that. And I'm sure that you use that in the work that you do as well, the slowing down, mindfulness, contemplation, and solitude, getting away from technology, dropping off, completely going off the grid, I would think, is part of the healing process.
Yes, it is. And that is very true. The one thing that we don't do in the society is take a deep breath and slow down. Okay, and sometimes you keep on going and going and going, and if you're getting this hint to slow down and you don't do it, usually what I find is the universe comes in and gives you a big old smack and knocks you down, so then you don't have a choice. Okay, so now you're sick and laying down instead of just sitting down under a tree enjoying some sunshine. So yeah, we need to start sitting and looking and feeling, listen to our bodies. So many people, I've got this pain here, I've got that pain there, I've got this going on. Your body is trying to tell you something. And if you're not paying attention to it, again, it will get to the point where there's going to be a mini explosion somewhere, and you're going to be forced to deal with it one way or the other. So yeah, again, part of what I do a lot of workshops, a lot of trainings, and in those workshops, I try and get people to, learn stress management, meditation, visualization, healthy body. What is health? Let's begin to heal. That to me is a perfect place to start. Just beginning, having a desire to heal.
Do you teach your workshops in Buffalo, or do you actually do some things online? And I know that you're about to start a Roads to Wellness Center. So yeah, tell us all about that. Tell us how you conduct your workshops, how you do your teaching, and I imagine that your center will be a local phenomenon, right?
I certainly hope so. I started teaching out in the community at like community ed centers, adult training centers. God, many years, probably 8 years ago now. And then since then, I've trained like at Alternative Roots and different places, the library, wherever will have me, whoever will put up with me. But now my next quest here, and God willing, everything goes okay, I'll be opening up a center of wellness, a transformational healing center in a couple of months. And my business, Roads to Wellness, will be incorporating not only the work that I do, but we'll be having yoga instructors and meditation instructors. I got laughter yoga instructor, which is absolutely wonderful. Uh, licensed massage therapist, reflexologist, people who work with past life regressions, tarot readers, psychics. I've got a whole section that's going to be dedicated to gardening and helping people to
Wonderful.
nurture themselves through gardening. We'll have a nice gift shop with all sorts of, herbal gifts and my essential oils and, just really neat stuff, yoga books and all sorts of things. So I'm envisioning a lot of amazing things. And
Oh, that
I'm
is
looking,
wonderful.
well,
How,
thanks. Yeah.
how often do you find that people's ill health is rooted in past lives?
Actually, I would have to say that all of us have some issues that are rooted in past lives. I had someone, he was a wonderful gentleman, passed away not very long ago, but was able to, really get into the past lives. And I was told that I had been murdered 8 different times for practicing as a healer in
Hmm.
my past lives. And I think, oh, okay, that's quite interesting. So I think that we all do have past lives, and I'm pretty sure that we drag something from that life, forward. And it wouldn't surprise me that, depending on where you're having your issues in your body, what illness you're experiencing, you could go into that past life and find out, it was related to whatever, you were stabbed with something or, something that got you into that position. But
Yeah,
definitely emotions.
go
Yeah.
ahead. I was going to say
Um,
just that it's hard enough to get to the baggage that we have in this lifetime, and also that the fact that if if you were actually murdered 8 times because of your healing gifts, I think you've chosen the right era to be born in. I don't think that's going to happen this time.
Right. Well, yeah. Well, that's pretty much what he said too. He said you're probably finally in the right place. That now I have an opportunity to not only understand and believe it, but to be able to share it. Part of the way I do that is every year I host a annual holistic health expo in Delaware Park in Buffalo. This is going on the 4th year now. Last year, I think we had a total of 75 vendors, and we have speakers and demonstrations throughout the day, and it's a wonderful experience. It's free to the public, and we just invite people in so they can get a taste of what holistic care and natural healing is all about. So yeah, I guess I'm here to create awareness, and part of that means I have to keep running my mouth so people hear all about it.
Well, now you must know or see that people are more open to these wonderful healing modalities now than they ever were. Don't you find that it's almost mainstream, if not completely mainstream? Whereas back in the 70s, the 60s, we were struggling to get these things out, and now they are. What's your experience with that?
Well, you know what? I am finding people are much more open to all sorts of, possibilities in healing, more than they have ever been. And that's wonderful, because I look back, even 10, 15, 20 years ago, and, you were a hippie if you tried practicing what we do. And it's becoming acceptable, and it's becoming okay. And I think aside from that, people in general are really kind of tired of just being, handed a prescription and saying, here, take this medicine.
Mm-hmm.
And unfortunately, our traditional medicine, that's the way they're structured. Although I'm starting to see a shift in that, at least in the nursing realm. Nurses are now being required to take a couple of holistic classes in the Buffalo area that I'm aware of for sure. So, we're slowly inching our way there and getting there. And that's just awesome to me.
Yeah, and also spirituality in mainstream medicine seems to be making some sort of rising up, whereas before that was a no-no.
Yeah, actually, how true. Yeah, doctors actually don't mind like saying the word God out loud anymore for the most part, and they're starting to get a clue that people they're more than just these physical beings, and they have something in here that needs to be attended to. And I think that's because we've seen some really excellent doctors out there who have been talking about this stuff and writing books about it, and I hope they all open their hearts. It's about time. And then looking and thinking the day may come, I don't know when doctors are actually allowed to practice as they should be.
Yes.
The insurance companies, the HMOs, they took their hands and tied them behind their backs. Mm-hmm. Doctors are now, they're kind of being stomped on when it comes to using their intuition. Many years ago, that's all doctors had. They didn't even have a certificate, that they were MDs. They just had their intuition and their experience. And so it would be lovely to see us get back to that point.
I was talking to a midwife yesterday, and she described saving a life, and it was in a way that it was like a split-second sort of decision, and she referred to it as an angel on her shoulder that sometimes tells her what to do, and then she hit the side of her head. It was really, it was so clever and beautiful. I thought, but I wanted to tell you too, I one time I have a radio show called Kate Loving and the Collective Wisdom, and I had Bernie Siegel on there about a year ago, and he works with the whole book is that his most recently written is, and it's something about healing. All you'd have to do is look on Amazon and see the most recent book that he's written.